I'm sorry, Laura, I'm sorry.
Sorry, I asked questions, but I just want to make a statement because I don't think we're going to do it at the end of public comments, which is this. And I appreciate all of the presentations that we got. I think it was really illuminating. And I say this with all, due respect to everybody. At a certain point in this country, we all decided collectively, and I'm just going to make an example here, that every child in this country deserved a great education, regardless of where they lived, right? And we don't ask parents to sit down when they decide where send their kid to school and look at what the school pays for the cost of books, to decide what they pay for their teachers. The idea that we're going to have consumers of healthcare try to parse out at any level what different hospitals are charging, what all the costs that go into care, and make some kind of an educated decision about where they should go to get medical care, to me is just as ludicrous as saying that before I decide where to send my kid to school, I'm going to go down a menu and a checklist of everything that they pay for. I know it sounds like a strange equivalency, but there's sort of, I think that why this conversation's become so polarizing and so difficult is that there's two schools of thought. There's one school of thought that says that people should buy health care the way you buy milk, and you kind of go out and you look at the different stores and you say, well, Trader Joe's is $6 for organic milk and Ralph's is $8, so I'm going to go to Trader Joe's. And then maybe you don't want milk, so you don't pay for milk. But health care is really different, and there's other people that think of it differently. They think that all of us, whether we're young and healthy, eventually are going to be hopefully old and sick, or at least old. We're all going to need health care along the line. And so we don't want to wait, that it's our responsibility when we're healthy and young to pay so that later on we get that benefit when we're sick and when we're older. And somehow we've had this disconnect in this country where people still believe that you should be able to opt out until you opt in. And in the same way that we don't say you can opt out of paying for all of our kids' education because we were all once young and taking advantage of that, or we don't say that kids in certain places shouldn't get a good education. Now maybe that doesn't always happen, which is a different issue, but we fundamentally in this country say that every child deserves an excellent education regardless of where they live, and that all of us are going to pay into that because that's our social contract as a society, and also that we all get the benefits of those kids being educated. We all pay the cost when people don't have health care, whether we think we're paying it or not. We pay it because we pay more when people are sicker. We pay for it because we have lost productivity with our workforce. But somehow we don't see that we all need to pay into that. So I agree that when, hearing these presentations, that some of us will think this is sort of like rearranging the chairs in the Titanic to talk about how we're going to, hang on a second, how we're going to make the system a little bit better. Now, cost containment is absolutely key, because if you have a school system that's spending all of its money on, let's say, tablets that don't work, you don't have money to go into the classroom. So you have to make sure that you can contain costs and really put your dollars where they count the most. And sometimes that'll even mean those social services like we were talking about. But I think that ACA, could have got us there if we had administrations that were willing to back it. But clearly we don't. And so all of a sudden people are realizing that what they thought was going to be something that they were going to have the benefit of, that wool may be pulled from below their feet. And so what I think everyone's looking for, and you see it with the people in this room, and we hear it from constituents all the time, is they just want certainty that they're going to be able to be taken care of when they're sick. They don't want to have to spend time trying to figure out how to buy insurance and where to put that money. And the system that seems to give everybody that is some form of single payer like they have in other countries. So, sorry, wait. I'm almost done, I promise. So, I'll just say that I believe it when people say that until we have a federal government that's going to let us do this, it's probably, I hate to say it, but it's probably going to be impossible for California to do this. But that doesn't mean that we don't design the perfect single-payer system and try to go out and do it. And maybe when we go to the federal government and they say, no, you can't have great health care in California, maybe that's what brings them down at the end of the day, you know? So, and I'm okay with that, but I think that, you know, I want to see this committee come up with, you know, a real universal coverage or single-payer system that actually has the cost containment and actually works, and does for medical care what public education did for education, for educating our kids. And hopefully we get to the point where we start arguing over, you know, kind of like we do with public schools, like is Burbank better than Glendale, and how do you make USD a little better? But fundamentally, you still have that same agreement that we're gonna commit to giving every child that great public education. We should commit to giving every citizen the best healthcare system that money can buy, and we just haven't made that commitment yet. So, I'm done.